All right, everyone, welcome back to the afternoon session. We're going to get started here. Everyone can find their seats.
Starting at 1:30?
Yeah, so supposedly.
We're getting started a little late because of some technical difficulties. Gretchen, sit down.
Andy and Jim.
Mari, do you have questions? We have questions in case anybody didn't have questions to fill in any awkward silence. But if you want to preview these ones, and if there's any you want to touch on, you're more than welcome to. If you want to take it. Those are ones that like came up with those are really bad, but not mine. Well, that's for you.
All right.
I think a lot of it.
All right, for those of you who don't know me, my name is Maddie. I am Simon's older sister and Gretchen's daughter. I've been coming to the PKS conferences since the beginning. And just this past fall, I had the opportunity to join the board, originally just as a member at large, and then I took over as medical liaison. Our main goal has always been to help promote research and facilitate conversation between the families and the doctors that work with us as well. So we decided to establish the Medical Advisory Board. This is our first year. These are our first time having all of the docs here. I know Dr. Vance has been in the past. But our main vision is to really facilitate that relationship between us as families and then the doctors as providers to have a collaborative care approach. So what we can do to help them, what they can do to help us. I'm going to hand it over first to our in-person docs to introduce themselves, tell us a little bit about them and what they've done with PKS, and then we'll have Dr. Coe on the Zoom also share as well.
Sorry.
Okay, good afternoon. So I know many of you here, and I'll just apologize in advance that I'm pretty bad with names, pretty good with faces, but don't feel bad if you have to remind me your name. So I'm a geneticist. I'm a pediatrician by training and specialized in genetics. I was at Children's Hospital of Philadelphia for many years, for over 30 years, and recently in the last 2 years, transitioned up to New York at Northwell Health and Cohen Children's. And we're actually establishing multi-specialty clinics up there, also clinics for PKS, and was delighted that Dr. Nira took over the multi-specialty clinics at CHOP, so that's still actively going on, and she's seen several of you in that clinic. So I got involved with PKS probably over 20 years ago, and it really started at Children's Hospital of Philadelphia, and we were following a few children with PKS, and there wasn't a foundation or a family support group. One of the moms at CHOP decided she wanted to get a family meeting together, and it sort of laid the initial seeds to building the foundation. Gretchen and Michael and other people who were there sort of said we need to formalize this. So PKS Kids grew out of that initial meeting, but what I realized when I started seeing kids with PKS is we didn't really have guidelines to know what were the medical issues. How can we optimize outcomes by making sure the kids were healthy and having all the services they needed to keep them happy and healthy and optimize their learning. And so we started to come to these meetings and see more kids at our institutions. And I always say that we learn so much from you guys. There are a few senior diplomats amongst you who've had children who, like Brian in his 40s here, that we've just learned so much about, and we can go back and sort of learn how to better care for children. And I know a lot of people have questions about targeted therapies, gene therapy, but to me, the most important thing to do right now is to make sure that the kids are healthy, that there are no ongoing medical problems that are causing pain or discomfort or leading to adverse behaviors and optimizing their ability to learn, to optimize their potential. So we got very interested and involved. We worked with PKS Kids in the early days and many families to just learn more and more about what the medical issues are. And there are a lot of medical things that weren't really recognized in kids with PKS that we then knew to look for specifically. So we're more, I sort of said last night that I feel like a bit of an interloper. I don't know exactly what families go through having a child with PKS, but we are your partners. We learn from you, we pass on that information to new families, and we all have the best interests of the kids in mind and keeping them healthy and happy. And we are all hoping that the future will be different in terms of having more targeted therapies, and we'll try to answer as many of your questions as we can.
Following that, Juanita Neira, I'm a pediatrician also by training. I'm a medical geneticist and also specialize in biochemical genetics. I work currently at the Children's Hospital of Philadelphia. And as Dr. Kran says, I currently am the medical director for the PKS and CDLS clinic at CHOP. I got also interested in PKS. Of course, I don't have the amount of experience Dr. Kran had, but interestingly, after COVID, when COVID happened, we started seeing so many patients through telemedicine, and I just started, discovering so many patients with PKS, given that we were doing way more local swabs than blood work that we used to. And I just started developing a little cohort where I used to work before, which was in Atlanta at Emory University, and I started following these patients. And then as I transitioned to CHOP, there was the opportunity to see, the patients with PKS as well. So that's how I kind of got involved. And currently, I also, want the best for your children, try to advise you. I know a lot of you get frustrated because your physicians where you live are not familiar with the condition. So we try to partner with you guys and with your physicians to provide the best care for your children. And yeah, for now, that I have stepped into the CHOP clinic, we'll try to develop some research and we can, talk about it in the future.
And my name is Bergen. I'm a genetic counselor at the Children's Hospital of Philadelphia. I'm newest to this diagnosis clinic. I work with Dr. Neira in PKS and CDLS clinics. And as a genetic counselor, it's a master's degree where we have training in medical genetics and also counseling theory and help families navigate new diagnoses and changes. So it's already been great to learn from everyone here, and I'm excited to be here and to learn.
And then Dr. Koch, you can hear us if you want to introduce yourself.
Sure. Can you hear me okay?
Yes.
I'm sorry that I cannot be there this year. One of my lab member had a family emergency. I need to do several culture stuff and all the things by myself. That's part of the reason I cannot be there. But I'm closely with me. I hope some of you remember me. I was there 2 years ago. So, and my name is closely with me. I'm a pediatrician and geneticist, and also I'm running a research laboratory in Dallas, Texas. So, yeah, thinking back, my connection with PKS started and I was a postdoc in Dr. Kran's lab back in 2010. So even myself is close to 20 years involvement already, so it's kind of time flies. But anyhow, I still see kids with genetic disorder in Dallas, Texas, and I follow some of the kids with PKS in my clinic, but I'm mainly focusing on research, trying to understand how chromosome differences impact brain development. So I'm mainly doing research, but I do have both interest in clinical side and also research side.
Thank you. So the goal of today's panel, we really wanted to open it up to you guys for questions that you might have. We do have questions to fill in if anyone needs to, but I've heard from Tim that some of you guys already have questions, so if anyone wants to go first, I'll hand it over to you guys.
this one working?
Hi, my name is Marissa. I have a daughter who turns 13 tomorrow. We're a Texas family in Fort Worth, actually, so I'm real curious about the clinic in Dallas. My question is, there is some treatment going on with the Center for SMA patients with the lumbar puncture. Is that anything that you think, and I don't know the term for what that procedure is, but do you think that possibly maybe would be any beneficial to help muscle tone for our kids?
Whoever wants to take it.
I can take a stab at that. So the treatment for SMA is a very specific treatment that addresses the gene difference in kids with SMA. Very different from PKS, and that's very specific for SMA. So that treatment would not be applicable to kids with PKS. It gets complicated, and we'll talk about treatment, and Dr. Azumi can address it. The diagnosis of PKS is fairly unique and different, and I think we all are racking our brains a bit about how to think about approaches towards targeted therapies for PKS, but it has complexities that many single gene diagnoses like SMA, and some diagnoses like SMA as well, which often the manifestations can be improved upon at the time of birth. So we always are happy for families to reach out to us. If you think of something like this or you're not quite sure, just shoot us an email or contact us, and we'll try to answer those questions as best as we can. But currently, unfortunately, there aren't any treatments like on the horizon right now like that for PKS because of the different complexities involved in PKS.
Thank you.
Hi, my name is Megan Stamps, and actually Dr. Mira Avery was one of your patients. She's 7, and I just made the connection. So good to see you. You were there from the beginning with us with her journey when we came to Emory, so you and Dr. Tallboy. So I'll have to let you see her. She's in the back now.
Please.
I know, I just made the connection in my heart to see. It's so good to see you. So I guess one of the biggest things that I've been grappling with, and I just talked to another mom about this. Can you hear me?
Yep.
We've seen endocrine, they tested her thyroid. She's very petite. She's still in 3-14 clothes. She's 7 now, weighs 28 pounds. Her height and her weight are pretty equivalent, but hearing from some of her specialists that she's failure to thrive, that she's not growing properly. From others that she's right on track with where she is. As far as size goes, that's kind of been something. She's on K-Farm's pediatric formula right now. We've worked with her GI to get that in. We're working on the feeding. It's slow and steady progress. She doesn't have a G-tube. Her GI doctor is very against it now since she does take so well PO with her K-Farms. But the size, I think that's been something that I've really struggled. She's so petite. So just, is that something that's kind of a baseline for these kids, as far as her size and her height and her weight are, equivalent? She's so little. As a mom, you want to see her continue to grow. Well, partially. I have to figure out. I have some mixed feelings, but I think that's something that I've struggled with the most.
Yeah. I was also talking about my patients at Emory this morning at breakfast. I was like, oh, maybe some of them will be here. So it's so nice to see you. I think what you're seeing is common in PKS. Like usually when they're born, they're big babies. We call them like macrosomic babies. But then as they grow, they start like falling off their regular growth charts. And it's hard to compare your child with a child who doesn't have PKS on the growth chart. So I would encourage your pediatrician not to do that because of course they're not gonna follow the same growth patterns. I think it's important that you've seen endocrine and that they check the hormones to make sure that there's nothing in addition to the PKS that could be contributing, but I think it's quite common and it's, I think it's very good. She's feeding by mouth and she's on a good, formula supplementation. So I wouldn't stress that much about it because you're doing all the right things, but it is important that her pediatrician understand that you're not neglecting your child, that your child is, growing as expected for the condition. So I think if she's already on a formula, her hormones have been checked, I think you've done the right things, and I wouldn't continue to stress about it. And she will continue to grow, but it would be at her own pattern. We do not have growth charts for PKS, and that's something that we've spoken with Dr. Grimes and other physicians in the field who that it would be great. So then, your child can be compared to another PKS child, but it's not there yet. But I think you're doing all the right things for her. But I'll let Dr. Grimes see if he has anything else.
So I agree with that, and I always like to say that just because your child has PKS, it doesn't immunize them against any other medical conditions that may not be related. So if it can't be really explained by PKS, the growth, then you do have to look for other possibilities. Although there are some kids with PKS that can have growth hormone deficiency. I don't know if she's been evaluated by endocrine and looked at growth hormone. And it might be worthwhile for Dr. Izumi, who's done some work in the area of growth, and understanding why the kids with PKS kind of can be big in utero before they're born, and when they're born and then they fall off the growth curves. He had some insights into that. I don't know if he wants to add to the conversation, but before he does, I'll also say that, as Dr. Nira said, so we've been at the meeting for less than 24 hours, but we already have 3 or 4 projects that have come up that we need to work on, and that's one of the power of meeting and talking to families and understanding that there have been issues that have been raised about kidney differences in PKS that we're not that clear on, the growth charts that's specific to PKS that we'd like to do, talking to Brian's family about sort of trying to capture more of the older adults with PKS and understanding what their sort of natural history has been. There's just been so many ideas that have come out, which is why we come to be inspired by you guys to do the work that needs to be done. So I don't know, Dr. Izumi, do you want to address anything about growth, or if there's anything specifically that you would recommend children who are maybe falling further off the growth curves than other kids that would help for evaluation?
Sure, yeah, I think, nothing else critically I would add. And so these, growth differences are mainly based on extra chromosome that you are born with. So even in cell culture, we see some excessive growth in prenatal setting, and then this growth slows down after birth. So we don't know how it happened, but that kind of, prenatal overgrowth and growth slow down after birth is nothing, nutrition or something like that impact. These are purely based on chromosome differences, cause these growth differences.
I have a question. I have a young child and he's 3, and it's kind of difficult sometimes to access services because you cannot really see his disability yet. So my question is there any reported cases, because that's always my argument, without intellectual disability? Because I feel I know that my child has a disability, but everyone tells me I need to wait until he's 5 years old to get diagnosis.
So I'm not sure I understand. Your child's 3 years old now and has
Yes.
no developmental involvement?
Yeah, I mean, I can see that he has cognitive issues, and he's delayed in a lot of areas, but he's healthy. So my question is, because my argument is that he will have intellectual disability, because I never read about a case who doesn't have intellectual disability. So that's my question. Is there any reported case? Because I don't understand why we cannot access some of the programs for kids who have intellectual disability.
Yeah,
Case where a child did not have intellectual diagnosis.
Do you know any cases?
So-
Is there a reported case without intellectual disability?
right. Not that I'm aware of. There's a lot more variability than we used to know, and the type of testing that's happening now, they're going to be able to detect this maybe earlier or even prenatally. And I think there's always been a bias in our understanding of the cognitive involvement in kids with PKS, because it was always more severely affected children that people would do a skin biopsy on. And normally you would test in the blood and you didn't see anything, you left it at that. But now I think with the new modalities of testing and even the NIPS testing that they're doing now, we may be finding kids that otherwise wouldn't be diagnosed. But I'm a little bit still stuck on why you're having difficulty getting services or having the diagnosis at 3 years of age, that someone's telling you to wait till 5 years of age. There may be some formal developmental testing that they can only do when the child's a little older, but given the known diagnosis and the ability to test for different parameters, have you seen a child development expert?
Yes.
Yeah. So, oh, she's okay. I don't know if you have insights as to what the issues would be in terms of.
Yeah, I mean, usually I know like neurocognitive tests, they prefer like to say definite diagnosis of intellectual disability by age 5 is usually when the developmental pediatricians and neuropsychologists prefer. However, there's some that can give it earlier, like around 3 and above. So I guess it also depends on the comfort level of the specialist that might be seeing your child. But I think with a genetic disorder, like, PKS or any other disorder, if we know there is a risk for developmental delay or intellectual disability, like they should qualify for services if it's therapies or things like that. I don't think you shouldn't wait to have a diagnosis of intellectual disability per se in order for him to qualify for services. So, and even if he's doing very well, I would still encourage you to plug him with therapies and stuff to reach, whatever is his best outcome. Because even if he's on the milder side, compared to some of our other patients, he should, be encouraged to get all the therapies possible. So if you're having any issues, just reach out and we might be able to help you.
Hi, my name is Melissa. I'm Debbie's mom. To answer your question, actually, there is a woman, I want to say she's about 42 years old. She has her PhD. I'm trying to look for her Instagram right now. The only reason she got diagnosed with PKS is because she had the stripe marks, the typo marks. That was the only reason they found out she had PKS. She went to the dermatologist. They thought she had an infection. They gave her an antibiotic. Nothing worked. They did a cheek swab, sent it out. The results came back with PKS. She's phenomenal. She's extraordinary. And the only other thing, because I did ask her a lot of questions, the only other thing that she has is high blood pressure. Mm-hmm. Which is nothing.
So I do believe there are going to be people out there like that, but it's unusual even if you have skin changes, if you're in your 40s and have a PhD and doing fine. I don't know why they would have sent genetic chromosome testing, because it's not routine. So I'm a little curious. I don't know about that particular case, but I think that's our bias.
Yeah, I think she got diagnosed when she was about 6, 7. It was because of the hormone.
Okay.
And then after that, she
Yeah. So we do think that it's possible that you have very low level mosaicism, that's, you know, those individuals are likely out there, but they're not usually doing genetic testing on people who are healthy and normal growth, normal development. No one's saying, oh, you should go get chromosomes done. So I think there may be more out there, but it's, they are starting to look at doing genome sequencing in all newborns as a newborn screening test. And I think once they implement that, and it's early, like right after a child's born, that you can catch it often in the blood, that we may really understand what the full spectrum of PKS is.
Hello. My name is Jen. I am Hildy's mom. Hildy will be 7 years old next month. We live nearby in Teachop, so we have a good fortune to be at several PKS clinics. My question is about orthopedics, because that's not a specialty that's included in the clinic at this time, but we're reaching a point with Hildy's growth and development where that's now, we have a potential hip surgery, a big one, kind of on the table. And so I have what's been recommended here. It's like this long for what her doctor is recommending at this time. I think what we're trying to understand is what is right now she's not in any pain. So how do we make a good decision about how to move forward with a really big surgery like that? What do outcomes look like for children who have PKS? Is doing a big surgery like this really truly necessary? Will we see, benefit from it? I think that's kind of how we're trying to make a good decision to move forward. The procedure that's being recommended is a hip varus osteotomy with internal fixation, adductor lengthening, possible hip open reduction, and acetobuloplasty, and possible hip arthrogram. My apologies for any mispronunciations.
Well, I haven't met your daughter, I think, but it does seem like a lot. Can you tell us a little bit how mobile is she right now?
Hildy's a wheelchair user. She is doing in PT, which she gets through school. She's using a gait trainer. She's beginning to initiate steps with some support. She uses, she has a stander, both a traditional stander and also an adduction stander as well. One of them is at home, one is at school. She does have, her hips are dislocated. The right one has moved out a little bit further than the left at this time, but they would recommend doing both if we do the surgery. But yes, because she's not ambulatory, and that does seem quite a ways off, I think we were just trying to understand if this truly makes sense.
Yeah, I think it's hard, to tell for sure, because right now she seems comfortable and has some mobility, and the surgery is gonna be very big. Definitely she's gonna be in pain, and it's gonna be very long months of recovery. I think the main question would be with your orthopedic doctor, what's the urgency of this? What happens if we don't do it? Because, if the bone is at a point where it can have necrosis or die from, I don't know, the position or something, that's an emergency. But if, I don't know, if he says that she could be like this maybe a couple more, I don't know, months or years, and it kind of depends. What's the urgency for the procedure? If it needs to be done, then definitely, if there's risk for the bone. We know that children with PKS can have joint hypermobility and some, a little bit of connective tissue issues, so, you know, the surgery is gonna be definitely a big one. And I know it's not gonna be, you know, the months after will be a little bit more challenging, because right now you're seeing her, you know, moving, walking a little bit with the walker and things, so that's gonna go back. Maybe she'll recover after, but it will take a little bit. So I would have like a partnership conversation with your orthopedic doctor and say, like, what's the urgency for this, depending on how her hips look.
Yeah, so I think it's always a balance, so I do think the surgery sounds like it's gonna be needed and important if she's gonna walk. So if she doesn't have this surgery, she will likely have discomfort in her hips as she grows and probably not be able to walk effectively. So it's that balance of what is the right timing to do it, how well is she gonna tolerate it, and in a child who is looking like she's heading towards ambulating, even with assistance, and it probably is something that'll be needed, but I agree with Dr. Nira, it's the timing. I know the surgeons always like to do these as early as possible because it's a developmental difference and the bone is growing and the joint, and the longer the hips are either dysplastic or not aligned properly, the more difficult it is to correct. But I think it should be a conversation with the orthopedic surgeon. And addressing your initial issue, in our multi-specialty clinics, there's no way that we can have in the one-stop shopping clinic all of the specialists. But what we try to do at CHOP and now up in New York is identify consistent specialists that we refer all the kids to so that they get experience with PKS. And then when you come to visit, if it's somebody who's not physically one of the specialists in our clinic, that we can then either in the morning or afternoon or on a subsequent day schedule an appointment so you can see those specialists. So as we learn more about PKS and the needs, we try to have the specialists in the multi-specialty clinic that's relevant to all the families. So we know that some families need an ophthalmologist, some need an ENT, some need a nephrologist, and then we like to have those set up that we have the right people to refer you to go and see. So it's not a definitive answer. I don't know if you're looking for us to say yes to the surgery right now or no. I think it really is dynamic and it's individualized to the child and their abilities. How old is she right now?
She'll be 6, she'll be 7 next month.
7. Yeah. So it's probably, I mean, this is something that was likely there all along. So it's probably at that age where it's about the right time to do it, even though I understand your hesitancy to head into that.
There's going to be some care perspective on that to point out. This major hip surgery has been a thing in multiple families. It's a success. Ours had it. It's been pretty successful. To confuse you even more, you might pull. So this is where you come to family and talk.
Yeah.
So you're yeah. So Jake actually, he was 6 years old when we were the same way. He had no pain, no discomfort. They convinced us that his right hip was out of socket. He'll definitely needed to avoid being in chronic pain when he gets older. His arthritis and bone rubbing on bone, it was constantly popping in and out. You could feel it. We did that surgery. It didn't go well. Both hips are out of his socket now, but back then it took him 4 days to actually wake up from the surgery. They ended up needing to re-intubate that night. They probably should have done a blood transfusion. It did hold for a few years, the right hip. Then we went to hospital for special surgery. Dr. Scher, he said he would talk to any PKS parent's doctor because he swore he knows exactly how to fix the left hip. They did the pelvic osteotomy, a femoral osteotomy. It looked amazing. We followed up every 3 months, and then a year later, the left hip was out of the socket. So he didn't have any complications from the surgery, but both are completely sitting out of the socket now. He's still not in any pain. We did see another hip specialist or pelvic specialist, and he had said if he were in pain, they could remove
the ball out of the socket completely. There was stuff they could do to stop the rubbing, but now they're both sitting so far out that the bone isn't rubbing on bone, and Jake under registers pain anyway, so we put him through those 2 major surgeries and they're dislocated anyway. That was just our experience, but it's just, he said he would never operate on another PKS kid that came in, given, he's like, this is never going anywhere. The low muscle tone, he just said, as tight of a socket that they built for that ball in there, it just completely over time, the muscle tone is what let it come back out, so. And I'd be happy to share his information if your doctor wants to speak to him too, so.
So I'll kind of give you our experience. So Isabella turns 13 tomorrow. We weren't able to come in 2024 because she had hip surgery June of that year. We planned it in June, so we have all summer to recover. She is a child who does equine therapy weekly, so she's riding that horse. She's in her stander, she's in her gait trainer, so she is standing a lot. And I say it, but I do say that, but she's also petite. So I'm able to move her myself without any help. If it's just me, I can get her on the horse, like it doesn't require a lift yet. She's very petite. So her hips were not out of socket in her visit in 2023. They majorly moved in 2024. And I thought, oh, did we do her a disservice by having her ride weekly? They said, no, her hips need to move. And so we proceeded with the hip surgery. I did delay it once because I got really nervous. And I said, no, if we want her standing, we want her maybe taking a step, or at minimum helping us with transfers as she gets older. I need those legs, those hips working. And so for us, so far it's been successful, and we check it every year. We'll go in November for her yearly checkup. So, and she had her surgery in June, and she was back riding her horse by October. So, and I think it's all different. It's all in, what are the goals? What are you wanting, what is, and I think that's what's hard for all of us to say, do it, not do it. And I think the beauty also for us in Fort Worth is our doctors at Cook Children's see a lot of families. And so our genetics is Mary Kukulich in Fort Worth, if anybody knows her name. She looked at Isabella when she was almost 1, and she said, oh, I know exactly what it is. It's PKS. And I'm like, great. Is she gonna walk? And she's like, oh yeah, that I know. She's like, that's gonna be, and I talked to Susan last time, she goes, that needs to be the answer, we don't know. It's all in the effort, her energy, her tone, and thankfully, our doctors at Cook, they have at least 4 or 5 other cases. And we all, I think, hate to say the word compare, but we need some kind of baseline to go off of and say, this is at minimum, this is what you can maybe, so I hope that kind of helps. It's just all in what the goal is. And the comfort level of our kid. So, hope that helps.
So anyone can answer. I know Dr. Coe said he does a lot for the research, but I'm just curious, are there any topics that you guys are seeing in your clinics that you feel like PKS research would really benefit from having further research in, or a topic that you as the primary doctors that we have right now who are dealing with these cases that you think would be a great place to dedicate medical fundraising to that could expand that research area?
Well, personally, I would like to see as many cases and as every system to see what else we can characterize, because I feel there's so little in the literature, to be honest. So we, on our side, are trying to expand kind of our questionnaire and things we grab when you guys come to see us, so see if we can characterize better. But something I've been curious is about some kidney issues that families have brought up more recently in clinic, which there's very little in the literature, and sometimes it could be the PKS, but also with time working in genetics, we learned that some patients might have more than one diagnosis. So sometimes we attribute, because we know this is a multisystemic disorder, and pretty much every system can have some involvement. I'm personally curious to see if these kidney issues is like a recurrent issue in our patients' population, or is it, if there's something we need to look further. But it seems that there might be some kidney issues that we haven't published, or nobody has published before. So I'm kind of interested to see that.
So I think I'm going to hand it back over to Dr. Izumi to talk about some of the research directions, basic research, but from the clinical side, I think what we need, in hearing a number of the questions today as well, is we need clinical guidelines. So we need to get all the experts together, work with some of the families and foundation to develop a manuscript, a document that really helps guide across all systems management guidelines for children, adults with PKS. I think other diagnoses have those. They get revised every 5 to 10 years as new information, but I think we should be working on that. And it comes back to what Dr. Nira mentioned initially about even having PKS-specific growth charts, I think would be great. I think understanding the natural history, I think RareX is a good start, but it might take a little more active intervention on the part of the clinicians and others to get the information that's needed to look at that. But I think maybe I would challenge our medical advisory group to start thinking about convening a working group that can start working on guidelines, medical management guidelines for PKS, so that any doctor in the world can access those and help. There's always new things that are going to come up, even just hearing the HIP conversation when we hear from families who've been through it, who've had good experiences or not good experiences. We need to collect all that information so that we can say what the best approaches are. So I think there's a lot of work to be done. There's lots to be done on the basic side, but I'm going to hand it over to Dr. Izumi to give his insights into what is happening in those domains.
Sure. I mean, the progress has been extremely slow, and basically that just takes time and also money. And so what we have been doing in my lab is using the donated sample from some of their kids, and we generated stem cell, and we are generating doing tissue in tissue culture tests and try to understand what's exactly happening in cells with extra chromosome. We have done multiple experiments using skin tissue and also also sample, but these are not the tissue affected in polysaccharidosis syndrome, and main symptoms are somehow related to brain dysfunction, muscle dysfunction. So now we need to start looking for these affected tissue, how at the moment these are. So now we have an approach to directly investigating what's going on in muscle or brain tissue, sample generated from this kind of special cell type. I hope that we can have better understanding about the mechanism and how to, in the future, translate into some therapeutic approach, hopefully someday. So in my lab, we are doing some of the differentiation experiments using stem cell, and hopefully we can find something informative to get treatment in the near future.
Does anyone else have any? Okay, go for it,
Well, just before you get to that question, I do want to say I didn't come with any other personnel, or usually we have our consent forms with us and we want to enroll families. But I think, I don't know if the foundation can set that up, if there are families who are interested in helping on the research side by sharing your clinical information, genetic information. If we can get a list of names and contact numbers, emails, or phone numbers, we can have our research coordinators, our genetic counselors reach out to you. And many of you are consented into research at at CHOP or other places, that's great. But we really would like to get an updated list of families who would be interested in being contacted and sharing that information so that we can increase our databases. The RareX is great as well for families who can participate. And that's more a resource for, you know, other investigators and physicians and other even families. But we have more targeted questions that we likely would like to put together. So if you're interested, hopefully we can get a sign-up sheet or someplace just so you have your names, the name of your child, maybe the age of your child and your contact information, and we can reach out to you once you're back home. Sorry.
No, you're good. So going on the kidneys, that was one of our areas that you kind of go through the list of specialists, going out of the NICU, and follow up with these specialists. Great, this looks good, this looks good. One of ours was cardiology. Avery saw a recommendation of her pediatrician at the time when she was diagnosed to follow up with a cardiologist, Dr. Stevens at CHOA. Dr. Neer, I'm not sure if you're familiar. He retired, but he had said 5-year follow-up, 7-year follow-up. Doesn't seem to have anything, nothing showing that she has any kind of heart condition. So we went recently, saw a new physician, Dr. Border at CHOA, and they did find, I have to read this notes, a small, I don't want to get this wrong, a mild ascending aortic dilation. And again, we like 5 years, follow up with this. So that's one of those things, it is mild at this stage, but it is above the normal range. But it's one of those specialists that I had on my radar, but not really. So now it's like, okay, cardio is obviously an important thing too. So historically speaking, is that something that you guys have seen a lot with the kids that you see in the clinic?
I'll briefly say, I think the cardiology we've learned also with some patients have developed some muscle involvement of the heart, like cardiomyopathy. So we are recommending like frequent follow-ups with cardiology, maybe not at the time I saw every, but I'm not quite sure about the dilation, maybe you've seen some patients, but we are recommending like follow-up with cardiology on a every 3 to 5 year basis, kind of depending on the child.
Now in 2 years, we'll see them in 2 years versus 5 years now, I guess. But it just kind of caught me by surprise. It's one of those things, checked out good, and
I mean, kind of within the hip and the connective tissue, the connective tissue is important for the heart and like the valves and kind of arteries and stuff. So I mean, maybe something we need to look more into. Maybe Dr. Kans has more experience, but you know, the poor healing with a hip dysplasia and all that could be all due to like connective tissue disorder that we have seen a little bit now also on PKS.
Yeah, so I would agree with that. I don't know of aortic dilatation specifically in this diagnosis. There are other diagnoses. And if you see some evidence of that, then the child obviously needs to be followed by cardiology. But cardiology is really important because I think a neonatal evaluation or newborn period of a child with PKS is important to rule out a structural heart difference, a congenital heart difference. And if it's not there, then that's not going to develop. But there are ongoing cardiac issues that we've known about in PKS, like Dr. Muir mentioned, the cardiomyopathy, the thickening of the heart muscle, which can be treated, especially if it's caught early. So it's important, even if you're cleared of having a congenital heart difference, to go back on a regular basis. And we usually have the cardiologist determine that, but it's usually every year and every 2 years just to get that echo done again. And if aortic dilatation becomes something we're not aware of, but we start seeing it, then that's another indication to go back regularly and be evaluated for. So thanks for bringing it up.
Can I say one thing?
Dr.
Yeah, he has to hear it through the mic.
What?
All of
Oh,
our
you need
audio
this.
is linked through the mic.
Oh.
Go ahead, Dr. Coe.
Yeah, so actually 13 years ago, back in 2013, we did a study cardiac manifestation in PKS. So we collected information about 30 cases PKS, and actually one of them had aortic dilatation, but none of them developed consequence from these. So, but you know, seems like maybe some small portion of kids with PKS may have, aortic validation that is not that common. And we also don't know that long-term outlook, whether these are colon nodules, still we need to understand more, but your case is not the only one. You have both PKS and aortic validation.
So I'm
Up in the top.
Willow's mom, and she's 15, and she had very close monitoring of her cardiac condition in utero, and then after she was born, and then we saw the cardiologist every year. She had regular dilatation, a little bit of mild mitral regurgitation. Everything was mild, it looked really good. We graduated to every 2 years, every 3 years. And then something called COVID came along, and I just dropped the ball and didn't go because it was one of those things that it wasn't very often. And then we went for her well-child visit, I think at age 14, and her pediatrician listened to her heart and gave me her stethoscope and goes, listen to her heart. Her heart sounded weird. So we went back to the cardiologist, and she had cardiomyopathy and fluid around her heart, and her ejection fraction was low, so her heart was working really hard and not a lot was coming out, and she had hypertension. Thankfully, she's on meds, and it hasn't worsened, but we now are members of the Heart Failure Club. And so we're seeing cardiologists regularly, so N of 1. So keep going to your cardiology appointments.
It's easy to drop the ball with appointments for like every
Yes.
so many that
Yeah, and pediatrician, wow, like that.
Yeah, no, thanks for sharing that. That's one of the systems that we really think it's important. A lot of families, they go and they get an echo and there's no congenital heart difference and they think they can cross it off the list. And like you said, sometimes you can't reverse it, but you can stop it with the meds. So the earlier they make that diagnosis, and the earlier they initiate treatment for that. Thank you. I can't believe Willow's 15. So.
I know, right?
And over there.
Okay, so going off of things we think we know about our kids and don't, and have a list. I was on our Role Parents work group on Facebook the other day, conference, and I saw someone mention, I apologize, the pineal gland in the brain, and that their neurologist was looking into like cyst tumors, that type of thing. Naturally, I Googled, we're supposed to, right? And I said that it controls like melatonin and sleeping and early puberty and blah, blah, blah. Just lining up all the things that all of our kids deal with. I mean, ask who slept last night, but also just to know in the future if something does continue to grow or show up that we know. And I just, on a list of things for PKS, another thing to look for, and I don't know how many years saw that post where you guys have come across if that's something that's common in our kiddos. I just know a lot of them have the symptoms of like with big switching their like schedules and early puberty and all of the things. So I didn't know if you had anything on that at all that you would share or see, or just also to share with parents. Like, if you have that or have known about it or anything, chat with me. I would really appreciate it. Anything to add?
So yeah, we've heard about this recently as well. The vast majority of kids with PKS don't have pineal differences or growth or absence of pineal gland. So probably isn't an explanation for the sleep issues that we do see in kids with PKS. But we do know that up to about 70% of kids with PKS will have some structural brain difference. Most of those are developmental. It doesn't really impact functioning in the way that, something on your pituitary or your pineal gland might. But we do recommend that kids get an MRI at some point just to evaluate for that. So, and it may be true that kids who have pineal cysts or differences may have an axis that's disrupted that might help more with management of sleep and other issues. So I think it's important, but it also underscores that we don't know everything there is to know about PKS, and we are reliant on that feedback. And often I do hear the Facebook groups that families are on, they share a lot of information, but the doctors aren't really welcome, and we really shouldn't be on those groups either, because it's also the forum where you can say, well, that Dr. Krantz doesn't know what he's talking about, don't go see him. But if you guys learn things through those groups, we love to hear from families that there's something else that's cropped up that we should be paying attention to.
Is that something you should like check every so often, like the heart, like every few years, or is that less enough?
I don't think so, not the brain. There's not degenerative or differences that go on the brain. So I think that once you've had an imaging study done at one point, that's probably sufficient, unless there's new onset of symptoms. If there's something neurologic going on or behavioral differences or something, then yeah, you always want to make sure there hasn't been bleed or something else happening in the brain.
And all the way on the other side of the room. Well,
I had a question that kind of goes along the same lines. It's about tethered cord. My daughter Della is almost 5, she'll be 5 in a couple weeks, and we've known she's had tethered cord since she's born, but she has no symptoms. So we have we currently are at Cincinnati Children's, and our neurosurgeon has recommended that we do not do surgery unless she has symptoms like monitored by like urology, like all of the different things like to check for. But I just wondered if there's any cases of where maybe there weren't symptoms and there was a problem, and if there's a precedence for having the surgery even without symptoms, if that makes sense, to prevent it, what's the recommendation on that?
I mean, I don't think we have recommendations or specific data, but I think again, partnering with your neurologist or neurosurgeon for symptoms, I think would be the most important. I just think that it's important to get screened for it if there's any kind of suspicion. I remember some parents saying their bowel movement and all that could have been better if this was catched earlier. So I don't know if your son or daughter have GI problems or things like that, which can be seen, of course, in PKS.
It's hard to tell if it's more like a rectum. Plus, we already have an issue going in, so.
Yeah. So yeah, I'm not. I can't commit to say that she's a girl, right? That she will not have surgery, but I think it's important to see what are the neurologic manifestations and how severe is the cord impact. If it's a little bit, it's a lot.
So I usually recommend correcting it. So a tethered cord is when the base of your spinal cord is attached to your vertebral, your sacrum most often. So what happens as you grow, the cord, which should be free floating, is connected, and so it gets stretched and pulled. And again, it depends on the child, but that causes a neuropathy basically. It affects the innervation of your bladder and your bowel and your lower extremities. So it can affect continence. So if you have a child who you're hoping will get toilet trained at some point and continent, that could have an impact. Or if they are going to be walking, that could have weakness in the lower extremities. So often it's not a big surgery, easy for me to say, but it's something, it's different than the hip surgery. It's a little more straightforward. They just release that, so it's free floating. So it's just one other thing that can help a child who is heading towards ambulation or potential toilet training down the road not to have some other confounder.
I think I'm next. My name is Bridget. My daughter is Brooklyn. She is 12 and a half. Since she was an infant, and I don't know if other parents have experienced this with their children too, we did meet one other family last year that had a similar experience with this, which is since she's a baby, it's become more predominant now because she's bigger, so her movements are more grandiose, I want to say. When she's falling asleep, several times a week, so not every night, but frequently, when she's going from deep sleep to REM sleep, her body goes into these episodes. They've been called neurological episodes. They last about 4 minutes. Her heart rate spikes, and the most obvious thing that happens is she has these great muscle movements, and it looks like what you and I might do when we're conscious, like twists and turns and rolls and kicks and has these kind of movements like that. They thought that they were seizures. That was completely ruled out, but it doesn't look like a seizure. I could see where like 100 to 200 years ago, they might have thought that she was possessed or something, because it really looks like she's out of body. But she's half conscious too, her eyes are open. So anyway, long story short, the geneticist is stumped, the neurologist is stumped. We're going into a sleep study in a couple weeks, because right now she's been diagnosed as a parasomnia event. Did I say that right? Parasomnia type thing. So I was curious, with your guys' knowledge and experience, which Brooklyn has a tremendous team, they're great, but you guys obviously see this more often. Does this sound like something that you're familiar with? It's kind of stumping all of us on her team. So I'm just curious about your guys' insight. Thank you.
I think we have
We've heard recently of another patient who's also a teenager with something similar, I think also London, I believe. And it's going through like sleep studies and some studies with the sleep clinic. But I don't know, we might be able to connect later on about the outcome, but we've heard recently about a teenager having similar issues.
Yeah, I don't have much to add, but one of the most important things is to rule out seizures. And as you transition to sleep state, that's all the time that seizures can manifest. So I'm glad that you did that. But these other asymptotic type movements, we've heard in other diagnoses, and I know that Klonopin and other drugs have been used to help ease those, but I don't know specifically about PKS.
natural study. We need like a natural study to look at all these. Yeah, in the meeting. Yeah. At least the gene reviews. It's the minimum. No.
It would be great to find specialists and review.
I have a mic, but I would just like to say ditto to what she said.
So she's a other kid with movement issues.
Took a long time to find find them, they did register finally teachers, and, usually there's going into sleep. Or is, and then also,
We'll transition over now, I think this is a good point, to kind of transition over to the parent forum, since we're starting to hit a lot of those topics that you guys have a lot of shared experiences with, so we just want to take a second to give our docs a thank you and a round of applause. Thank you, Dr. Ford, for joining us virtually as well, we appreciate you being here. And then for our newer families and those who may have missed it, Dr. Krantz is doing appointments tomorrow morning. There are, I believe, 2 appointments available. If you haven't registered for that, my mom, I believe is the best direction, to see about those. And then going forward as well, like Dr. Krantz mentioned, we really want to be able to facilitate a lot of these questions from you guys to them and back. The goal of the medical advisory board not only is to target areas for research, but also to serve as that kind of pathway between you all. So, does anyone have anything they want to start the parent forum with? Do you want to continue the senior conversation we were having? Questions? Oh, I see Heather in the back.
So we were just talking about the same thing, because Annabelle, she'll be asleep and just start thrashing around, almost to the point where I feel like she's like break her heel because she's kicking so hard. And she was just saying, is it possible it could be like neurostorming instead of a seizure? I don't know the answer, but neurostorming instead of a seizure? She had just mentioned it, and so then we were just looking at it. And it sounded very similar to what is happening. So if they can't figure out if it's a seizure or not, maybe that could possibly be something. I don't know. I'm gonna bring it up to my doctor too. Yeah. And then my next question is, we deal a lot with GI. She's constantly constipated, we're using enemas quite often. Does anyone have any natural solutions we could try? Also, any olive oil as something that she's too tight as well. When you hear that, sometimes it gets where I can almost feel it. And it's so good that when she was Miralax,
Nobody wants to.
And I love that it's all her questions, so.
But then does it eventually normalize?
No, she has like, I do a lot of tummy massage, and also.
I would love to answer this. Juliet, Gracious Mom. I don't know how many times we went to the ER because I thought she has to have a blockage, gloves, anything to help her because it would get so bad, so stuck, so compacted. And a friend told me about Trace Magnesium. I think I've posted this before. It's a blue glass bottle. You can get it at any grocery store, drugstore, anything. And I don't know what, there's so many different types of magnesium, but Trace is the brand.
Okay.
We do.
Is it like a magnesium citrate?
I don't think it is. Carrie's gonna look it up.
Okay.
It has changed our lives, like literally, I'm getting a clap. What is it?
Magnesium glycinate.
Glycinate? I don't know, just go get the Trace, whatever, I can't pronounce. But we give her 2 droppers in the morning, 2 at night. We haven't had any issues whatsoever. We also figured out a good bathroom routine that I'm happy to share with anyone.
Right now, it's like, if by day 2, she hasn't gone on her own at all, we have to intervene her.
Yeah.
We're in big trouble.
Well, we intervene every night and then we put her on the toilet. So it's great because then we know when she's going, and it's not always the case that she goes right then. But, oh gosh, it has been awesome.
How
It's,
quickly does it start working? Like, if you do the droppers, are we looking at?
it's not like a I don't know. We do 2 drops in the morning, 2 at night. I think we did more to start. I can kind of show you later what amount, but yeah, it's been awesome and I would highly recommend, and we're never going off of it. And we've cut back on our Miralax too, because I think that was giving her some stomach cramps. So we're only doing a half instead of a full cap.
Is it sugar free?
I am sure it is. It tastes awful. It's like salt, very salty. I think it's just a natural magnesium. I don't think it has any added yumminess to it. It's just, yeah. Yeah. Oh, I know.
We're talking about constipation in general.
Constipation.
Okay. So I missed the very beginning of this question, but Una's been taking Senna. I give her 2 tablets every night. I started with 3, which was the suggestion. And it was just too much. And for anybody that just eats orally, I think using the right foods is super helpful too. We used to go for Mexican food once a week, and a bean burrito and a cup of pineapple juice worked every time. But sweet potatoes, that seems to be the magic touch.
There's more?
No.
Oh.
I was trying to.
What else? This can go literally anywhere, so.
Hi, I'm Lulu. I'm Kaylani's mom. We're having a lot of trouble with her, like hurting herself and trying to pull her eyeball out. Are there's any like suggestions to help with that situation? Because we do use like the arm braces, but sometimes she's Houdini and she can get out of it.
We have not solved that. No, with those are good, but yeah, because Patrick's just on the armbands too, and because he detached his retina from punching himself in the face so bad. That's why he wears sunglasses all the time. So no, we haven't solved it, but those are helpful. He chews on those. Well, that's what.
We get them off, but sorry. So we use these little gloves that Utah. They Velcro, but then it has a little chain at the top that you put it in the top, but he gets out of them, so at night I sewed another Velcro strap that he can get out of them. And modify them, they really just work soft, for football, so. I can send it to you. Thank you.
Here. No, go ahead.
So Isabella has a real hard time chewing on her hands. And so we had like the hospital immobilizers that they do when they're doing IV, but we switched to the bamboo braces. That's some industrial strength Velcro that ain't nothing. That kid can't get, she might be able to move her arm up, but they're not coming off of her. So I have a link, and I think I even have a discount code for them because we share them so much. But bamboo brace is a good, and they keep, oh, there you go. There you go.
You're welcome.
Yep.
So Samantha is 17, but she consistently pokes her eye. Do you guys have good ideas on how to prevent that? Because I have tried the gloves. I've even hockey taped, yes. I've hockey taped the gloves.
but she's like a MacGyver. She gets out of everything. So anyone use like,
Is it just to raise the elbows, do you think, or?
and it's just this eye, and she just pokes it, and it just, I feel like she's gonna poke it out.
Yeah. Hers is the left eye, yours is the left eye, yours is the left eye?
No, mine's the right eye.
I don't remember which eye it was.
Are they having pain?
I don't know
No,
if it's a
so we had-
stimulation thing.
That's exactly what it was. So we asked the eye doctor about it. He said, you know what it is? It's like, do it to yourself. You see all the stars and the colors, and he said it's a stimulation thing. Because, you know, they see it and they probably likes it. It's like a high for him. But he's gonna pull his hand away, put his arm braces on, like haven't figured out a fix.
Goggles, I consider that.
Yeah,
Considered it.
big lab goggles. I mean, why not?
Extreme fun.
Yeah.
I think something happened to someone, right? I saw that on the Facebook site.
All right, anyone else have a topic question you want to talk about? Anybody else?
Swallow first, maybe.
You have your job again. Conversation. Nicole's trying to make sure I don't choke.
Yeah.
No. Okay, real quick before the topic. Anyone who's interested in sharing their child's genetic information for research like Dr. Krantz talks about in his panel, the sign-up sheet will be back here by Jake. You can just put your name, your child's name. I have all the information you'll need on there. But I know I touched on this a little bit last year for newer families who have newer siblings here as well. I always like to touch on the topic of siblings of special needs in PKS Kids. Natalie and I are fortunate enough to be getting to witness the next generation of siblings kind of come into our realm here. And yeah, Jake, I know, stealing the spotlight. But it is always something to touch on and to think about. I know we got to talk about the special needs trust and all of that in our morning discussion as well, but there's always, I feel like, this kind of gray area with siblings of what to expect, what not to expect from your siblings. Natalie, we've always joked that we'll be fighting over who gets to take Simon into our home. It's never been a question really for us that one of the 4 siblings will have him, and I'm fortunate enough my husband is super on board with moving Simon in tomorrow if we need to. But it's always something as your kids get older to just kind of have that open and honest conversation with them, because for some people that's just not an option, or maybe not something that they're comfortable with, and you never know what life is gonna bring. And at a moment's notice, they might need to step in. Yeah, Willow. But just being really open and honest with them and letting them know that if that's not something that they feel they're able to take on, that's also okay. I think we put a lot of pressure on ourselves as siblings to make life easy for our parents, and to do what we can for our siblings, even if it means sometimes stepping out of your comfort zone, and not everyone's always gonna be ready for that, and that's okay. I always wish we had a sibling panel, but I also love letting the younger siblings run around like this. Siblings face a lot of different challenges, especially in middle school. Kids are mean, and I feel like siblings don't know how to navigate that just because we don't have a network for it. But us older siblings always say, and we said it last year at the end, but if your kids ever need somebody to talk to about navigating challenges as a sibling or life in general, or how to handle kids at school, our contact information is everywhere, or you can reach out to our parents, but we'd love to help them navigate that as well and let them know that there are people out there who understand what they're going through.
Okay, that's really good, and maybe we'll even make a sibling page on the website. We're getting all sorts of,
We used to have a Facebook page.
yeah. We're getting all sorts of.
I don't know.
That might be a good one. Anybody have a question for Maddie or a sibling, or do you want to bring up some other topic? I have a list of topics that might be fun. You guys are-
Might be my friends.
I don't really have a question or anything, but I wanted to talk to you siblings directly. I'm gonna cry.
Hold on, she's crying.
Okay, sorry. I struggled a lot with whether I should have another child or not. And after the last conference and seeing all of you guys, how much you support each other, how awesome you are with your siblings and just how well you navigate life really helped with me with that decision. And I just thought maybe you guys should know that you're here and you're not overshadowed and you're not unseen. And we really, really appreciate you. Now take this away from me.
And all in there, who came up to that, or they came up to the new sibling and they just sucked it into their little life. You know, like,
There's no shyness at the PKS conference. Yeah, so, unless you're Tim Kelly.
And how do you think, you always bring up something, unless you guys just want to get out of here that time too, but I know that sometimes this last hour of the conference, Gabby's gonna speak, you know, brings out a lot of good stuff, so.
Did anyone talk about eye gouging? Okay, sorry. I had someone was banging their head next door, so I'll talk to people after. Well, yeah, it seems like the more we restrain her, the more she's like, oh, now I'm free, and it's worse. So, yeah. So. She does like the snake thingy that pulls out and pulls in. Yeah, that plastic thing that she has right now. So that's been a nice thing.
Has anyone else found that when they, a lot of times, he does it when he's got to poop?
Oh.
So we'll give him a suppository and he calms right down.
Okay.
It's not a be all end all,
Okay.
but a lot of the times when he's upset, he's either hungry or he has to poop.
Okay.
But pretty much it. He's uncomfortable. Yeah, which is typical. When he's happy, he's not hitting himself. Not really a solve, but
He's communicating something.
exactly.
I'm pissed off.
Exactly.
I wanted to bring up a topic about helping our kids fall asleep, because I've seen a lot on Facebook and we've tried a lot of things with Jake. And we have varying levels of success, but there was something with a C that people were Clonidine. Can someone talk to that? Like, what is that and does it work? And
Yeah. Kaylani's been on clonidine, I want to say about a year. It does good for a few months. As soon as she's like prescribed it, they up the dose, she's good. As soon as I guess she gets immune to it, it's back to normal. At least she'll get some sleep, but she's up maybe 4 or 5 times. And she'll get up super early, ready to party at like 2, 3 o'clock in the morning. I want to try and find something. She knows what she does. She's been sassy since conception. She knows what she's doing. I want to try and find something else that will help, because I noticed the lack of sleep, the more seizures. Before clonidine, she was like a crackhead. She was up for like days, no sleep, no nap, no nothing. And I'm kind of happy she gets some sleep in, but I wish she would just get more.
I just wanted to, clonidine is typically used for high blood pressure and ADHD. So those are, but it's supposed to also help, because actually her grandmother is on clonidine as well for,
I didn't know that.
yeah.
My mom?
Mhm. She's on it for her ADHD.
I don't pay attention to stuff.
Our story with clonidine is the exact same as yours. He's going to be going for a sleep study because he has sleep apnea. So the mask, he's on the mask, right? So we're hoping it's helped me. So.
Sophia did not sleep well sometimes when she was younger. One thing that I noticed that was bad was full moons were bad. Those would be nights that she seemed to stay up a little longer. But later in her life, we did have a neurologist that put her on L-theanine at night, which is a natural enzyme. And she went out like at 100 milligrams. And then she really slept well with that. And I took it and I really slept well with it. And Liam takes it and he feels really good sleeping with it. So I don't know, you'll see the gummies, they'll sell L-theanine with melatonin. But Sophie could not take melatonin. It did something weird. She got these little pinprick rashes all over. So we never used it. When we did use the L-theanine by itself, that was really helpful.
Another thing is someone did mention already, I use a topical magnesium for my sleep, and that has helped a lot as well. We're all efficient in that, so that could be something easy to fix.
Yeah, as she was saying, clonidine is an alpha agonist originally prescribed for hypertension. And as happenstance, they found kids that were on stimulants for ADHD, that this would help them kind of come off the stimulants and help them fall asleep. And then it got FDA approval for ADHD for monotherapy. So like most of what is prescribed for our kids for sleep, it's just drowsiness is a side effect of it. Trazodone, gabapentin, clonidine, guanfacine, all of these side effect drowsiness. So it's prescribed. And so what nobody talks about is what we really need to do is when our kids wake up, get them outside for 30 minutes. Morning sun helps with the melatonin production in the evening. Get them outside in the morning, and then at night, dark for the last 45 minutes to an hour before you want them to go to bed. I know we love the twinkly lights. No twinkly lights at night. Dark at night. Not the hour before bed. And the L-theanine, some people it's helpful. If you're deficient in L-theanine, it helps. Some people can tolerate melatonin, 1 to 3 milligrams. These 5, 10, 20 milligrams, no, that's not for our kids. And if you have a doctor that is willing to, or a nurse practitioner, that is willing to go outside the box, you can maybe ask for a wakefulness agent for a couple days, and then maybe some Ambien for a couple nights just to break the cycle. So but really, I know it sucks, but get your kid out in the morning, keep them awake as much as you can during the day, and then dark at night.
Makes sense?
I would like to reinforce that twinkly light thing, because when we were having a lot of trouble with Sophie having those seizures right when she went to bed at night. And it was a conference here where somebody said that getting rid of that really helped with nighttime sleep. And so we did, and it wasn't just twinkly lights, it's watching a screen or your TV in a dark room, anything that's kind of just that light in the dark. So I got rid of all of those things. You know, she had some toys that had the spinning lights, got rid of it all, and it really did make a big difference.
Sleeping is so, I'm just sorry, you're not sleeping, I'm not chasing myself. She's been on it for over 3 years, and it's awesome. So I say try it.
What was it?
The clonidine. 0.1 is all she's been on ever. Every once in a while, I give her a second or a half of one. I've probably done that 5 times in 3 or 4 years, but it usually works. No, we haven't had any side effects.
We haven't either.
I think it's been a miracle for all of us.
Okay, knock on wood.
Well, I think it just goes to the point too, that you have to find the right medication for your child and what works with them. Because medications, even with us adults, they don't work for some people and they work for other people.
All right, anything else you guys want to talk about? Yes, so I obviously a lot of parents. She is my niece. Also not a sibling, but any advice for me as a support system for my niece and after loving daughter. Because I know there's times she starts to laugh and sometimes I forget it. And sometimes I just go silent. And when she's ready, she'll come. But anyways, for someone like me,
Make sure she gets sleep. Sleep is the biggest one.
Just you being here alone for your niece is speaking volumes, for her, like that. We have grandparents here. I have extended family here with me. So, she has her parents here, her nurse, that alone, it's easy for me to say, so I'm a doer. People say, oh, I'll let you know if I need anything. No, here's what I'm gonna do. I'm gonna call you and give you two choices. You want Chick-fil-A, you want McDonald's. You pick it and I'm dropping it off. You want me to go to Target for you, or you may go to, we have H-E-B in Texas. I'm gonna do an order, what do you need? Okay, well, I do need a rotisserie chicken, I need milk, okay. That is what you do. You become a doer. If that's something that, that is, but you being here alone is huge as an extended family or as a family member, so.
Oh, go ahead. I wanted to add to that. When we're in like hospital mode, having someone be like a liaison, you don't want to answer a million questions, you know what I mean? Yeah, it's like, it makes me emotional because it's sometimes, you're doing it all. Yeah.
You're gonna see she's tired. So, just sure you don't have that. I do. Just do that. And that's sometimes my struggle. It's like having a frustrating moment with her. And I'm fine. And I'm just getting to that point where it's like, I want to just take her and.
I'm gonna stop you. I'm gonna go to the bar.
So, yes, we live together. She's lived with me for like the last 2 years. Little background, she moved back home to help out with my mother, her grandmother, who was very ill. And when she passed, she just decided to stay. And so we've been living together since. Sorry, I'm gonna cry. But having them living with me has been a blessing. This little girl lights up my world every single day. But yes, so my thing and I want you to hear me. When I'm asking you to give her to me, because I know you're having a moment, just hand her over.
It's hard.
I know it's hard. But yes, I agree with you. There's times I just want to step in and just grab her and be like, just let me have her. And then you just go, take your moment. So for you too, just let me. Okay.
Well, it really touches me. It sounds like you're living in a situation. But
You know, as somebody who has gone through this for 42 years, I think the most valuable thing is time with absolutely no responsibility.
Yeah, yeah, exactly.
All of us are responsible 24/7. And the biggest thing you can do for yourself, for your heart, is to let everybody know. Because I think it's something that we all need. Yeah. So I don't know if you said something specific, I don't know what your life is like, but if you can say to her between 2 and 4 on Wednesday or whatever it is, I'm giving you 4 months. And just set it up for a couple of times a week. So you're forced into it. So you can say, oh, yeah, because you don't know that you need it, but the responsibility just weighs on you and it builds up.
Yeah.
And you don't want to be in a situation where again, and I don't think it's all nervous right now, but I've been in a situation where while I was really frustrated and things were just floating on me, and I had a glass of wine in my hand, and I just sat down and I threw the wine across the kitchen because I was wanting to take care of my mom with Alzheimer's disease. I could take care of my daughter with PKS. I could take care of my younger daughter who had ADHD. And the truth of the matter is, I just couldn't treat her. The best thing that you can do is to take time responsibility. Absolutely.
I would just like to echo that, because there's 3 people in this world that can take care of kids outside of you. 2 of them, and that's to be in college. One person is not another, and that's it. So being that person is.
And I just wanted to make a comment. I think it's very, very hard. It was very hard for me when people said, hey, you know, I could do something for you, because I just couldn't think of how to train someone or figure out even where to start to hand things over. And what I found really helpful over the years was that I did have professional caregivers that were in my home, and I saw the things that they could do for me. And so, for example, one thing was just ordering supplies, staying up on, because sometimes our kids have supplies that they won't do an automatic refill for. And so then you're constantly having to remember that I've got to order that medication on that day or something like that. And so one of my caregivers left us, but she used to still stay up on my orders for me. She had 4 or 5 things that she said, Roxanne, I will order those for you. I will be on that. And that kind of thing was great, because what Sharon is talking about, that constant noise in your head of the different things that you have to do. We used to take Sophie out of town, and at one point we just sat down and Google listed, these are all the things that she's gonna need. Like, she's gotta have this and this and this. And so then I could hand over to somebody and I could say, hey, can you help me pack? And then I'd give them that list. When we had to move to somebody taking care of Sophie in the morning, did the same thing. This is her morning routine, wrote it down and handed it to the new person, and we didn't have to take so much time to plan. So it is really hard to hand things over to people, but those are some of the ways that you might be able to.
And it's good for the future too.
Yep.
And I wanted to touch on something too. I don't know if Kehlani has any siblings, but I think like kind of how Heather said, when your child's in the hospital and, you know, you need someone there, I think it's also important, like, you know, my daughter's at home. She's 16 and she's like, no, I'll just stay home when we have to take Philip to the hospital for whatever reason. And it's like, I think even just when her aunts know Philip's in the hospital, we'll go pick up Chloe. We'll keep her occupied. We'll keep her busy, because they can, I don't know, maybe she feels, okay, they're focused on him. he needs it. But then I also don't want her to feel left out or left behind, or, I don't want her to feel any kind of way. And I know that she's loved on everybody in our family, and just making sure that they are there to keep her busy, to keep her occupied, to keep her mind off of, even she worries as a sibling. So just also being there for their, the other kids in the family and stuff like that.
Go ahead. This was a question that got submitted to one of our forums. So my mom, I think somebody on the board who has access to the parent groups, because I'm not a parent obviously yet, posted forms for medical questions. Those will be able to touch base with the medical advisory board throughout the year, but also for life questions. And I didn't have an answer to this, and I did some research and I wasn't really able to find anything solid, but one of the questions was, is anyone aware of scholarships for special needs siblings? And if anyone has any information or answers. I know that's something that's come up a few times over the years, and I haven't had any luck finding anything. And it's okay if not, I will keep researching.
Yeah, and if you ever hear of anything, send it to me, send it to Mike, wherever. But that is, that's really an interesting question.
To set one up somehow.
You're going to set one up?
Stay tuned. I'm really ambitious. And
I have a daughter in college right now.
yeah.
Yeah. I know, that's really a cool idea. All right, what else we got out there?
I'm just wondering if anyone, it seems like everyone has their kids at home, also the older ones, and I don't know, I feel like if my son is older, maybe he wants a little bit more peer connection instead of just hanging out with the adults. So I'm just wondering if anyone has a success story or to share, or is it that is there in the US nothing like?
Do you mean like a group home or a residential home? Something like that?
Yeah, I don't know, I know it from Europe that some adults who have intellectual disabilities or other disabilities, they live together and have some caregivers. And I'm just wondering if this is like a good concept, something that is working where people are happy, or
I'm gonna let
not.
Sharon give her experience, because Lauren is in a group home. Is that right, Sharon?
Yeah.
Go ahead.
Well, Lauren is in a group home, but she has severe disabilities, so she's very different from your son. But I think there are probably group homes that he would be able to go into with people who are higher functioning. But the 4 people who are in Lauren's group home all need supervision 24/7. Lauren has a lot of physical needs, so I don't think he would thrive in that kind of a situation. So although she's in a group home and it's working out really well for us, I don't know if that would be the kind of situation where your son would really thrive and reach his full potential. So what state do you live in?
I'm in California, but that's another thing, because we don't have actually any family, no one. So that is why I'm a bit more concerned about the future. Also, he's my youngest, so I got him quite late. And I don't know, it just keeps me up at night often if I don't know, can stop to think about the future. I would love to keep him at home, but at some point, I will just not be there anymore.
Well, when we first met Dr. Krantz, I think Lauren, I don't know, was maybe 20 or something like that. Dr. Krantz said to us, well, do you have any plans for Lauren, when she gets older? And I just went, live forever? Yeah. That was my answer, but we're not going to live forever. But I know in the state of Virginia where we live, there are situations where they have people with disabilities who are living pretty much on their own in apartments, and there are, and sharing apartments with other people, and they have basically supervisory help to come in and just make sure that everything is okay with them. So I would check into something like that in California. Yeah.
So as a resident of California, as a Californian, I would say that, well, first of all, is your son a regional center? Is he no more regional center? Because he's high functioning enough not to? Well, he doesn't have the physical disabilities, but will he have the ability to live on his own?
So he has like, it's in California, it's like they changed the law, so he does not get lanternman automatically. So he will only get, I think, lanternman he will get it at some point, yeah.
So through something like the regional center, you have that power of self-determination if he is a regional to make his own plan. And there are many, many people in California whose kids are living on their own with services and in programs. So it just depends probably on the level of his disabilities if he gets older.
So so they will take care of him if he's like 40 or?
Well, I mean, yeah, I have friends with, because they don't really care what the disability is. It's not like a PKS group at the state level, but there's lots of different levels of support for people who have qualified for them. Okay. So if he qualifies for them, I have several friends who have, most of these are autistic, people with autism, but they also people with disabilities from different syndromes and different issues. And so they have all different levels, people who have jobs, and yet they might have somebody that comes in and checks their finances or makes sure that they're living in a safe environment and different things like that. So yeah, there's many, many different layers of support depending on what he would need. How old is he now?
He's only 3, so that's
only
not the
3.
point.
Well, if you get a chance, maybe we can chat.
You need to get on those wait lists, I guess, and also I just want to know if anyone has like a good experience, because otherwise I wouldn't assign him. I mean, he stays home then, right?
I do know many people who have good experiences with their children out of the home.
Okay.
Yeah.
And I do believe there are some states that are probably more friendly. I know people do move states sometimes and choose one that they get better benefits from, which it's a good one. That's good to know. But I
have a siblings question. So I'm just curious, siblings, as some of the older ones, as you've had, a PKS brother or sister, what did your parents do well? You guys lived with parents that were in a constant state of fight or flight. You've seen so much. What did they do well to help you process, to help you just become thriving, teenagers and adults?
I think my experience is a little different. Me and Simon are only a year apart, so it's really I don't know any other anyway. Everything was just normal in our house. They never made it a big deal. Obviously we were aware of everything and we were involved in knowing all the things that were going on, but they never made it a big deal. So even if it was a big deal, let's say Simon was in the hospital, one of them was at home, we were still going to soccer practice, we were still going to play dates. They made it so that all the attention wasn't just on him. They always created normalcy in the house, because it's not a fair life, but they wanted us to have a fair life. Maddie probably has a different experience because she has the 5-year age gap, so.
I think Natalie summed it up really well. Obviously she was a baby when Simon was born and my mom was pregnant with him, but they did a great job of preparing us ahead of time for Simon, because we were fortunate enough to get the diagnosis Haley, I don't remember how far along you were. But just they kind of said, your brother's gonna look a little different. He might act a little different, but he's still your brother. And I think that was something that always stuck with me and still does. Like Simon has always just been my brother. And then we were fortunate enough, my mom came and talked at our schools. So that kind of helped us, I don't want to say mitigate some of the like mean kid behavior of growing up. But it really gave like our community a perspective. So my friends grew up coming over and Simon's hanging out on his blanket and they always would be like, hi Simon. Like my parents made it a very welcoming environment, and that's something I always joke my mom's way better at that. If people are staring in public, mom's like, come say hi. Where like Kayla, Zane and I are like, what are you doing? Like, so really making it like a normal environment, but also a welcoming environment. There was never a time we couldn't ask them questions about Simon or what was going on. Never a time that it felt like our friends were gonna be like on edge coming over and things like that as well.
I also recommend, because I had friends that were uncomfortable, just don't push it. Don't make it uncomfortable. If you don't want to say hi, you don't have to say hi. That's not your normal. It's my normal, but it's not your normal. So making your family, friends as comfortable as possible. Simon's there. They're going to know about him. He's going to be on the floor. He's going to be yelling. Sorry, the house smells. He pooped in his diaper. What are we going to do about it? But never make, I want everybody else to be as comfortable as possible. And they never made anybody talk to Simon. And they encouraged it. But it was always nice to like almost separate in a way. Like a lot of my friends love Simon, besties. They like Simon more than they like me. But some friends aren't used to that. So they never pushed it. We never pushed it. I think that was really important to like never force it on anybody. Either of you have anything? Yeah, you don't have, no, I didn't.
Okay, come on, there's some more gold out there. Let me get some more.
I was gonna say, we need other people. I'm like tired of hearing me and Natalie.
I'm here. Hi, I'm Olivia. I'm Demi's older sister. I feel like my parents were like pretty transparent with us when we got Demi's diagnosis. And at first, like, yeah, like it was hard, but they made like our environment like very like comfortable. Sorry, I'm gonna cry. But I have obviously younger siblings, and it's good to see them grow up and learn that it's okay that like other children are different and that they're so welcoming to other people, and having them like learn that at such an early age and try to understand that is like really like beautiful to me. And even going based off of what Natalie said, like having my friends come over and stuff, like we're so like welcoming and like open hands that like my friends do also understand that, you know, Demi may not be able to speak to you, but she shows her love in like so many different ways, especially with like her communicating device. Like she controls that with her eyes, and that's like a big wow to like a lot of my friends. So they do communicate with her most of the time. And they do know that like Demi can be sassy sometimes. And even if Demi was in the hospital, like my parents would just continue our day-to-day life, going to school, going to sports, hang out with friends. Like they wouldn't ever just have like that main spotlight on Demi. They would just continue it as if she was another child in our family.
I'm scanning for other siblings who want to talk. I feel like Tim.
Hi, I'm Samantha. I'm Elliot's older sister, sorry. I'm 13, so I'm still pretty young, but ever since Elliot was born, like my parents kept it pretty real with us, like the expectations of what were gonna happen and like what life was kind of gonna be like. But they were definitely really helpful because it was new for all of us, and there was never a moment that I couldn't come to my parents with any questions, and they would be honest with us and tell us like the truth. And it was really helpful to like, they're like, even if they were stressed out with Elliot, even if something was happening, like they would always answer my questions, even if it was like a scary answer or a sad answer, like it would always be answered. And like growing up with Elliot, I'm really thankful because it's opened like my eyes to a whole new kind of world. Just coming to these conferences and even hanging out with other kids with special needs and like at my school volunteering for that. And like, I'm really thankful, especially how great my parents have been. And me and my older sister, our bond kind of grew like greater because of my brother. And again, with like friends coming over and hanging out, my mom's been really good with like any questions, like, because everyone's obviously curious because it's very different. They'll be happy to answer them and happy to explain things. And like every day that it's always something, it can be really stressful, but we always like, they always make time for me and my sister too, and always care a lot for us too, even when it's really stressful in our house. But it's been great, and even coming to these conferences and getting to talk with the other siblings about it, it's really helpful because I can come here and I don't have to like explain it, and I understand people are curious, but I don't have to like explain why my brother does certain things or why certain things happen, and it's just a really like safe space. And my parents, they've been really good, so yeah.
Yeah, go parents. That is something I would always encourage, and even if I'll say it explicitly now, but I think we always kind of try and radiate is bringing your siblings or the siblings to the conferences. Sorry, I'm not running away from you. I'm just trying to come back to the main group. I was fortunate enough to grow up alongside PKS Kids, so my world with Simon has always included the siblings. So we've been fortunate enough to bring new siblings in over the years, and some have come and gone and we aren't as in close with, but I know that if they ever needed anything, we'd all be there at the drop of a hat. And it's a huge support group for us, but also to just kind of bring a normalcy to being a special needs sibling. Nobody's gonna know what we're going through better than each other in this room. And even just getting that time of like, okay, even Natalie and Kayla and Brandy can probably attest to this. I don't think I was ever in the kids' room that long. But like, okay, I'm gonna go hang out in the kids' room and play with all these cool kids. Well, my parents were in the conference, but it's like, that's a memory they're gonna always have that's associated with PKS, but still feels like such a normal thing. Like, oh, I'm at a play date basically, but you're in a realm of a community that knows exactly what you're going through. Yes. Okay, Miles wants to answer, but he wasn't here for the question. So we were asked as siblings what our parents did to really kind of help make life normal and not feel like we were being overlooked by our siblings. He shrugged.
What'd your mom do right?
Yeah, what'd your mom do right?
With raising special girls.
You don't have to answer if you don't want to.
Or what do you wish your mom had done different?
He's thinking on it. That's okay. Caroline's got it.
So I don't, y'all probably can't see me, but I'm okay. My name's Caroline Mayfield. I'm Anthony's sister. Do I have to say like how old I am? Okay. I'm about to turn 15 in the end of July. I'm going to my sophomore year of high school, and something that like specifically my parents did was and we're still continuing to do this, is bringing Anthony around the world. And I think that's really special, because I think it's good to spread awareness that even if it's hard, especially traveling with special needs, that it's good and it can be done. And even though it's hard, like, you know, me and my family have definitely like strived to like, you know, make sure Anthony has the same experience that we can, because he can, and it's awesome, and he deserves to see the world as much as we can, and because it's a beautiful world that God gave us. And yeah, that's really all I have to say, because that's something that I think is really adamant in our family, is traveling and spreading that awareness. So yeah.
Are there any other siblings in the room who want to comment? Jameson always wants to be on the mic, so does Tim. Avery?
I would just say, reiterate what Maddie said, bringing them here, or any like sibling outside, like even on social media, if your kids aren't here, like adding other kids their age, us, we're all like kind of one big family. I mean, like we hang out now outside of this, like we travel to see each other, and like go abroad to, like, we have great relationships, and like, even if your kids aren't here, like, they're automatically going to be welcomed into this without question. And so, like Maddie said, like, having a community associated with PKS that isn't just medical, my brother, my sister, like, there are really good, genuine friendships here. And I feel like we all are, you know, very open, and, you know, we're all mature and travel, and everyone's always, you know, saying you guys are such a great group. And it's because we are the only ones who can understand this situation. So just bring your kids around, even if they're not here. Like, we're always here. There's generation 2 is starting, so all ages of kids, like siblings, have a community here. And even if it's not here, we're always interested in seeing, like, it's just fun to meet other kids and realize that, like, you're not the only one who's like having your brother's diaper changed in your living room. Like, just having other kids your age who understand the weirdness of your life softens the actual, like, diaper changing part a little bit.
So maybe it's time to resurrect that PKS sibling group we had on Facebook, and maybe we'll look into that. Yeah. So that's really good. We're about ready to wrap up here, and I just wanted to say a few things. Number one, a lot of you didn't know about these shirts, and I'm sorry about that. We're gonna work on some kind of communication thing. I don't know, I've tried a few things, but they don't seem to work. They are still available in the PKS store. So pkskids.com, and then look for store in the upper right corner. Well, the store only shows up on like a laptop or computer. Otherwise you have to go through the menu.
I thought it was
And Jackie wants to say something about t-shirts, but now she disappeared.
She wanted to say right after.
All the siblings.
Okay.
Yeah, so dinner, picture, Olympics.
Oh, there she is. Okay, and also I noticed that there's more donations in the back. There's a lot of feeding supplies and stuff. So make sure if your kids are on two feedings, there's food and other supplies back there. And Jackie is in the room now, so. Do you need this?
Jackie, do you need a mic?
Thank you. You do need a mic, I have 2 choices. Far back, my back, right, your back, left. Remember, all the t-shirts for the siblings are in order to make candy for you.
So all the t-shirts are printed and ready to pick up?
Yes, except for maybe 3 or 4 that will be today.
Okay.
Anybody's size is not there. I took everyone's down last night. I just asked out right down names, just did my best. Like 60-something shirts up here, so please, siblings, you can wear them during the little kind of after dinner. Dinner starts at 5.
Dinner starts at 6.
Oh, perfect. So sibling Olympics will be about 7. You do that?
Sibling Olympics of around 7 o'clock tonight.
Patio out here. Okay. And World Cup theme, aka Red Solo Cup theme. Just kidding. But I know you probably maybe not all know what size you gave me, especially the little kids. So please try to grab a size you told me because if I run out, sorry.
Then we're out.
I got 4 shirts in my room, but not smaller sizes. I think that's some more patterns left, but.
Okay. So I believe that, like last night, the bar and the pavilion will be open at 5:30, dinner at 6. We want to do our big group photo before sibling Olympics in case there's injuries or anything, you know. So, kidding. So we're going to go down for our group photo, and then Jackie will organize sibling Olympics. 6 for dinner, probably 6:45-ish for the photo. No, outside, just, we'll start yelling at everybody in the pavilion to go outside like we did before, go down and around. Yeah, right on the golf course. Okay, anything else, Mike? He left. All right.
Once again, anyone who's interested in submitting their genetics for research, the sign-up sheet is back by Jake. That'll be with the one Dr. Krantz talked about with his team. I believe all of the appointment slots for tomorrow are filled now.
They are all full with Dr. Krantz, so.
And I know Dr. Krantz mentioned any medical stories, feedback, things you guys have that can be sent to them, you can send to me, and I will get that to, I believe Bergen is going to coordinate it for CHOP, and then Dr. Krantz as well.
And just stay on top of your email if you see our name in there, because we're going to be sharing a lot of things, so.
I think that's everything, unless Mike has something. Oh, Roxanne, did you need this?
Yeah? Did someone say my name? Jackie.
If I miss anybody or if the wrong size, just tell me. I do have more shirts in my room. I just can't do it, you know?
I did just. Okay, so go grab your shirt, siblings, and then we'll see everybody at the bar at 5:30. In the pavilion bar.
Set up a reminder group, because then what you can do.
I probably was in front of your mic or your video. Was I?
During the conference,
I hope you would have
the same ones.
Oh, no, you're fine.
And then you can send me little reminders, hey,
Thank you, Megan, for being the only one commenting here.
That's a good idea. Where they're
do that when we do the conference next year.
Yeah. A reminder.
All right, we're gonna end this here. We're gonna get ready for dinner. We want to thank anybody who tuned in. Maybe tomorrow we will go live here on YouTube, and you can just kind of get a little glimpse of our little Saturday party. So, thank you, everybody.
In this YouTube live.
Oh.